Understanding cystic fibrosis, causes, symptoms, treatment, and coping methods. Today we're diving into a topic that affects millions of people worldwide, cystic fibrosis. Whether you're here to learn more about this condition or seeking answers for yourself or a loved one, you've come to the right place. Hey there, welcome back to Mind State. We're here to help you tap into your full potential and become the best version of yourself. In this video, we'll explore the ins and outs of cystic fibrosis, from understanding what it is and who it affects, to the symptoms, treatment options, and even coping methods. So grab a seat, get ready to expand your knowledge, and let's embark on this enlightening journey together. But before we move forward, don't forget to like the video and subscribe to our channel and tap the notification bell so you won't miss any of our uploads. What is cystic fibrosis? Cystic fibrosis is not just any ordinary illness. It arises from a flawed gene that runs in families and is passed down from one generation to another. This gene defect leads to a disturbance in the production of essential fluids like mucus, sweat, and digestive juices. Normally, these fluids are thin and slippery, but in individuals with cystic fibrosis, they become thick and sticky. Now picture this. Instead of smoothly lubricating the body's passages and airways, these secretions transform into obstacles, blocking the tubes, ducts, and airways within the body. This blockage creates a range of challenges for those affected. Breathing becomes difficult as the airways get clogged, and the digestive system faces obstacles in delivering crucial enzymes from the pancreas to the small intestines. Although it may sound daunting, it's essential to know that there have been remarkable advancements in the management of cystic fibrosis. While a cure has not yet been found, scientists and medical professionals have made tremendous progress in screening techniques and treatment options. This progress has positively impacted the life expectancy of individuals living with cystic fibrosis, offering hope and a brighter future. Who gets cystic fibrosis? Risk factors. Cystic fibrosis is an inherited condition, which means it is passed down from parents to their children. Specifically, a child needs to inherit one copy of the mutated gene responsible for cystic fibrosis from each parent to develop the condition. If a child only inherits one copy of the mutated gene from one parent, they will not develop cystic fibrosis themselves. However, they will become carriers of the mutated gene, which means they could potentially pass it on to their own children in the future. Determining the risk of cystic fibrosis involves examining family history. If there is a history of cystic fibrosis in the family, the risk increases. On the other hand, if there is no family history, the chances of developing cystic fibrosis decrease significantly. It's important to note that while cystic fibrosis can occur in people of all races, it is more commonly found among individuals of white descent, particularly those with North European ancestry. Symptoms of cystic fibrosis. The first category of symptoms associated with cystic fibrosis are respiratory symptoms. Thick and sticky mucus can clog the tubes responsible for carrying air in and out of the lungs. This obstruction can lead to a persistent cough that produces thick mucus, making it difficult to clear the airways. Individuals may experience wheezing, which is a high-pitched whistling sound when breathing, as well as exercise intolerance, where physical activity becomes challenging due to reduced lung function. Additionally, the accumulation of mucus can lead to repeated lung infections, causing inflammation and damage to lung tissues. The second category of symptoms involves the digestive system. The same thick mucus that affects the respiratory system can also block the tubes that carry enzymes from the pancreas to the small intestines. As a result, individuals may experience a range of digestive issues. This includes foul-smelling or greasy stools, which can indicate problems with nutrient absorption and digestion. Poor weight gain and growth may also be observed in children with cystic fibrosis. Furthermore, the blockage of intestinal tubes can lead to intestinal obstruction, causing abdominal pain and discomfort. Chronic and severe constipation, accompanied by frequent straining during bowel movements, can also be experienced. How is cystic fibrosis diagnosed? To begin with, reviewing the family history is an essential step. Since cystic fibrosis is an inherited condition, understanding the presence of the mutated gene in previous generations helps assess the risk and likelihood of developing the condition. By identifying whether there is a history of cystic fibrosis in the family, healthcare professionals can determine the need for further testing. Genetic testing plays a crucial role in diagnosing cystic fibrosis. This test involves analyzing DNA samples to detect any mutations in the cystic fibrosis transmembrane conductance regulator, CFTR gene. Genetic testing can confirm the presence of the defective gene responsible for cystic fibrosis. It is usually done through a blood or saliva sample and helps provide a definitive diagnosis. In addition to genetic testing, a sweat test is commonly performed as part of the diagnostic process for cystic fibrosis. This test measures the levels of salt in a person's sweat. People with cystic fibrosis tend to have higher than normal salt levels in their sweat due to the impaired function of the CFTR protein. By analyzing the salt concentration in sweat, healthcare professionals can further support the diagnosis of cystic fibrosis. Treatment options. Although cystic fibrosis currently has no known cure, there are various treatment options available that can help manage the symptoms, reduce complications, and improve the overall quality of life for individuals with the condition. Let's explore these treatment approaches in more detail. Antibiotics. People with cystic fibrosis are at a higher risk of developing lung infections. Antibiotics are commonly prescribed to treat and prevent these infections. By targeting the bacteria responsible for the infections, antibiotics help reduce inflammation and promote better lung function. Anti-inflammatory drugs. Inflammation in the airways can worsen respiratory symptoms in individuals with cystic fibrosis. Anti-inflammatory drugs, such as corticosteroids, are used to reduce swelling and inflammation, thereby improving breathing and lung function. Mucus-thinning drugs. Thick and sticky mucus is a hallmark characteristic of cystic fibrosis. Mucus-thinning drugs, such as hypertonic saline or Dornis alpha, can help break down and thin the mucus, making it easier to clear from the airways. This can improve lung function and reduce the frequency of lung infections. Airway clearance techniques, also known as chest physical therapy, are a vital component of cystic fibrosis management. These techniques involve various methods, such as manual chest percussion, postural drainage, and breathing exercises, which help loosen and mobilize the mucus in the lungs. By promoting mucus clearance, these techniques can improve breathing and reduce the risk of respiratory complications. Surgical procedures. In some cases, surgical interventions may be necessary to address specific complications associated with cystic fibrosis. For instance, nasal and sinus surgeries can help improve breathing by alleviating blockages in the airways. Additionally, bowel surgery may be performed to manage intestinal blockages and improve digestive function. Ongoing research and clinical trials. The field of cystic fibrosis research is continuously advancing, with ongoing studies and clinical trials aimed at developing new treatments and interventions. Staying informed about the latest research and participating in clinical trials can provide access to cutting-edge therapies and contribute to the advancement of cystic fibrosis treatment. Coping methods. What now? It's completely normal to feel a mix of emotions, including sadness, anxiety, anger, or fear, upon receiving a diagnosis. Talking openly about your feelings and concerns with trusted individuals can help alleviate the emotional burden and provide a much-needed sense of understanding and empathy. Your friends and family can be a source of comfort and support, as they can offer a listening ear, practical assistance, and help manage stress. In addition to relying on your support network, seeking professional help from therapists, counselors, or support groups can provide a safe space to process your emotions and develop coping strategies. These professionals are experienced in helping individuals navigate the emotional and mental challenges that can arise from living with a chronic condition like cystic fibrosis. Educating yourself about cystic fibrosis is crucial for understanding the condition and its management. By learning about the latest research, treatment options, and self-care practices, you can become an active participant in your own healthcare journey. Stay informed about new developments, advancements, and resources that can enhance your understanding and help you make informed decisions. Open and honest communication with your medical team is highly encouraged. Your healthcare providers are there to support you, answer your questions, and provide guidance throughout your journey with cystic fibrosis. Don't hesitate to discuss any concerns or uncertainties you may have. They can provide personalized advice, recommend appropriate treatments, and address any challenges you encounter along the way. Cystic fibrosis is a complex condition that affects multiple aspects of the body. By understanding its causes, symptoms, diagnosis, treatment options, and coping methods, individuals and their loved ones can navigate the challenges associated with cystic fibrosis more effectively. Remember, you are not alone, and there are resources available to provide support and guidance along the way. Thanks for watching, Mind State fam. If you found this video helpful and enjoyed our content, please show us some love by hitting that like button and subscribing to our channel. We promise to keep bringing you insightful takes on anything and everything that matters. We appreciate your support and look forward to seeing you in the next video.